Hello everybody, I'm Dr. Chaitali Trivedi, a laparoscopic and hysteroscopic gynec surgeon and a cosmetic gynecologist from Nanavati Super Speciality Hospital. Today I'm going to brief you on fibroids, which are also known as leiomyomas or myomas. Fibroid is a common terminology which is used for soft tissue tumors of the uterus. They are usually non-cancerous. Now, fibroids could be located in any area of the uterus. It could either be inside the lining of the uterus, it could be inside the wall of the uterus, or it could also be lying on the outer area of the uterus. Some fibroids are very notorious and they could also be lying in the broad ligaments or the cervical area, and these are quite difficult and complicated to treat. Fibroids could be single or they could be multiple in numbers. So how do you diagnose a fibroid? A fibroid is usually diagnosed on an ultrasound or a sonography examination. That's the reason we always insist on an annual checkup or a sonography examination annually, because what happens is then this fibroid is diagnosed at a very early stage. When it is diagnosed later, then the surgery is more complicated or the treatment is more complicated. Now, looking at the treatment options, we have non-invasive and invasive treatment options. Among the non-invasive treatment options, we have medicines or tablets or hormonal injections which help in shrinking the fibroid by 30% its size. But the fibroid still stays, and once we stop the medicine, the fibroid does come back to its normal shape and size. Then we have the uterine artery embolization and the HIFU treatment, which helps in degenerating the fibroid and decreasing its size. But these are not complete treatments. When we look at complete treatments, it's a surgical treatment. Amongst the surgical treatments, we have either a myomectomy, which means removal of the fibroid, or a hysterectomy, which means removal of the uterus, which helps in removing the fibroid automatically. Now, looking at a myomectomy, basically what we do is we cut open the surface of the uterus, remove the myoma, and then stitch the wall of the uterus. This is usually done in patients who want to preserve the uterus, as in a young patient who still has to complete her reproductive cycle. The only problem with this treatment is that the fibroid can recur in future and she may require a second surgery. Now, if a fibroid is lying inside the cavity of the uterus, we don't need to go from above. We go through the normal birth passage, cut the fibroid into smaller pieces and get it out. So the beauty is that there is no scar in this surgery. Now, coming to the hysterectomy part, removal of the uterus helps in removing the fibroids, because the fibroids come out along with the uterus. Now, the best way to perform these surgeries is laparoscopy. Now, we do not cut the whole abdomen like with a vertical scar or a horizontal scar. We make small openings which are 10 millimeter and 5 millimeter openings, and the whole surgery is performed through these openings. Now, what is the advantage? Oh, there are multiple advantages of this. Basically, what happens is that the recovery of the patient is very fast in this case. The patient starts walking from the very next day of surgery. She can join work within a week's time. Pain is very minimal after this surgery, because bigger the cut, the more the amount of pain the patient has. And of course, these scars are cosmetic, so they are hardly seen after surgery. Again, looking at the intraoperative part, there is less amount of bleeding or chances of hernia or infection and all these kind of cases. So why not go for a laparoscopic surgery? Again, hysteroscopy, as I already mentioned, doesn't have scars. So this is the new era wherein we do most of the gynec surgeries laparoscopically or hysteroscopically. Now, you'll ask me, what about bigger fibroids? How can you remove a big fibroid through that little opening? Well, even big size fibroids can be removed through other techniques in laparoscopy only. And least to mention, of course, I hold the Guinness World Record for removing the largest uterus of 4.1 kg, wherein the fibroid was around 21 centimeters, which we removed laparoscopically. So all big fibroids can be removed laparoscopically. So next time when a surgery is advised gynecologically, you have to remember that there is an option, laparoscopy or hysteroscopy, to remove these kind of fibroids.